I'm Amanda Vanstone, Chair of Vision 2020 Australia. When you're born in a developing country, it often means you don't have access to the essential services that we take for granted here in Australia. Depending on where you are, there may or may not be a school, a hospital, a doctor, or even a decent road. If you're like me and wear glasses, you'll appreciate the importance and value of clear vision. Without good vision, it's hard to learn, hard to get around, hard to get yourself a job and to support yourself. Over 220 million people are blind or vision impaired globally, the equivalent to around 10 times the Australian population. Sadly, 90% of these people live in developing countries. Imagine living with low vision in a place where you have limited access to services and support. Women account for around 2/3 of all people who are blind globally, and 1 in 5 people living in developing countries are living with a disability. Both gender and disability increase vulnerability and the vicious cycle of poverty. As Chair of Vision 2020 Australia, I've seen firsthand how effective Australian aid has helped to significantly reduce avoidable blindness in our region. Eye health programs are a great example of effective Australian aid. They build up local health systems, strengthen training institutions to develop a strong local workforce, and support national partners to improve policies and service guidelines. In Cambodia, Australian aid has helped revise the National School Health Policy and School Eye Health Screening Guidelines. This ensures that all Cambodian kids have vision loss detected and addressed early. In Vietnam, teachers have been trained to integrate kids with vision loss into the classroom. Helping kids stay in school and complete their education is essential for creating opportunities later in life. Look, it doesn't matter what your politics are. We can all take some comfort and genuine pride because our Australian aid really does change lives.
I'm Barry Jones, Vision 2020 Australia patron and former chair. Leadership from Australian government and non-government organisations has been crucial in addressing avoidable blindness and vision loss as a major barrier to the development of people living in our region. When I chaired Vision 2020 Australia, both the Australian government and the opposition made pre-election commitments to invest in ending avoidable blindness in the region. Subsequently, the Australian government was influential in gaining a global consensus for targets to reduce avoidable blindness and vision loss. It also supported the Australian eye health sector to work effectively together with our regional partners. The good news is that this has resulted in a clear plan to reduce avoidable blindness and vision loss, and that despite population increases, we're starting to see a decline in the prevalence of avoidable blindness and vision loss. Great results are being achieved, with Australian NGOs and Australian aid having made a substantial contribution to these improvements. The significance of this for our region is enormous. Eye health programs have proved to have practical and long-lasting impacts for some of the world's poorest and most vulnerable people. Investing in avoidable blindness and vision loss prevention is cost-effective, with a $4 return for every dollar spent. It just makes sense. As a nation, we can all be proud of the role Australians and Australian aid plays in working towards a world where no one is needlessly blind or vision impaired.